Hello, I am Tu Kim Lam. Welcome to the Medical News Show from Washington, D.C. According to the National Health Interview Survey 2009 of Centers for Disease Control and Prevention, the number of asthma patients have increased to 4.3 million from 2001 to 2009, or 12%. 1 in every 12 persons have asthma, and the number is higher in children. Each day, there are about 3,500 people die of asthma. Here with us today is Dr. Tran, who is currently practicing internal medicine in Fallsburg, Virginia. He will talk about asthma and the latest medication to treat the disease. Welcome to our Medical News Show, Dr. Tran.
Hello and welcome to our Medical News, and hello, Ms. Lam.
Dr. Tran, today we're going to talk about asthma. First of all, would you please tell audience what asthma is?
Asthma is a very common disease, and if you're aware of that, and I think it's your family members or relative or friend may have asthma. But what's asthma? Really, asthma is in the past, people believed because of the narrowing of the airways or bronchoconstriction of the airways. But now, the most experts believe because it's causing by the inflammations of the inside of the airways or bronchi. And the narrowing is trigger the constrictions of the airways. Therefore, the people develop short breath or asthma because of the inflammation and because of the narrowing of the airways, means the structures inside the lungs.
So you mentioned that asthma really affects the lungs. Would you explain to our audience how the lung function in our body when it's normal and when we got the asthma attack?
It's very important to understand is how's the lung working. If you look at the screen, you can see the lungs like the two big balloons at both sides of the chest. And inside the lung, you can see the whole airway system from the bigger one to the smaller one. And then all the airways will come to the final place called small alveoli. This means a small balloon or pockets. And when we inhale, all the balloon will inflate. When we exhale, all the balloon collapse. So means the lung is the big balloon, is composed of about thousands of small, tiny balloons. The function of the lung is very important because they carry the oxygen in the air to the blood, and through the blood will carry the oxygen to different organs for the body to use it. And then they will carry the carbon dioxide back to the lung, and the lung exhales these toxic gases to the outside. In case of the bronchoasthma, a little bit different. If you look at the pictures on the screen, you're going to see on the left side the airway is normal, open, patent. But on the right side, the redness inside the lumen of the airway is causing the obstruction, and the whole airway system is become narrowing and irregular because of the bronchoconstriction. So in asthma, remember, two factors very important: inflammation causing by the chronic irritation of the airways, and the constriction or narrowing of the airways because of these factors. So that is the pictures of the asthma that we need to know about.
So what are the common risk factors that cause the asthma, sir?
The risk factors is very important just to remember. Is number one is genetic factors, I mean it only run in the family, and secondly is allergy, because they are correlate very well. People with different kind of allergy may develop asthma later on, and they may have allergic reaction to different things like dust, pollens, and the cold air, etc. But very important in asthma, sometimes triggered by exercise, and we call exercise-induced asthma. Usually happen in children, teenager, including the professional athletes as well. So very important, because when the child run and develop short breath, be careful because they may have some underlying problem related to asthma. And I think these the two factors very important to remember is genetic factors, and allergy.
So according to some current study that food also trigger asthma. Can you tell us more about this?
Yes, that's correct, because right now, in the past we believed that certain kind of food may trigger asthma attack. But nowadays they found that in the food there's one chemical called sulfite. It usually is used as preservative to keep the food on the shelves longer, keep the meat look good, red, and keep on the food longer. These substance sulfites may trigger asthma in these people with underlying problem. I think that's very important to remember, because be careful about the food we eat, because it may trigger some asthma attack.
So besides those factors that you mentioned above, are there any other factors?
The other factor is very important, is related to the stomach. And there's one disease, stomach may trigger asthma, we call reflux esophagitis. Reflux means is because the end of the esophagus open. It's not closed during sleep or after you eat. Therefore, at night, sometimes the acid or the mucus stomach may go backward to the throat and may enter the airway to the lung and trigger suddenly short of breath at night. And that's usually happen because of the stomach-related problem rather than just from the allergy. And that, I think, this related to stomach. Beside that, certain kind of medication we're taking, especially the beta blocker, and usually used for hypertension or from heart problem, that may triggers the asthma. Especially sometimes the eye drop with the beta blocker eye drop, they may trigger asthma in these people as well. Aspirin is also may causing problem.
So how can a patient know if he or she have asthma? What kind of symptoms do they have?
The symptom is very clear on certain patient, because they develop short of breath and wheezing. What does wheezing mean? Wheezing means when they hear some musical sound, when they inhale or exhale, the sound that triggers and bother people, they cannot sleep, and they always have trouble breathing. And the other symptom related to asthma is chronic cough without no evidence of any underlying causes. And especially when people develop asthmatic attack, they may become very short of breath, they sweat, they try to get some air but they couldn't get. In these cases, the patient should go to the hospital or call 911, because it may interfere with their respiratory failure, and they may die if they cannot get enough air in about 5 or 10 minutes.
So what are the current methods used to make the diagnosis of asthma?
The diagnosis of asthma is usually the physician rely on the symptom and the histories of allergy. But it's not everybody with short of breath, wheezing, have asthma. Therefore, sometimes we have to rely on certain kind of tests. And one of the tests called pulmonary function test try to differentiate the short of breath and wheezing from people who smoke and without smoking, people with asthma, or we will maybe have some wheezing from the other causes, sometimes from the heart or some other causes, pneumonia. And therefore, the pulmonary function test is very important to differentiate these people to make the right diagnosis. But sometimes it's very difficult to show it. And we have to rely on the special test called methacholine challenge test. Methacholine is one of the chemical. That chemical, when the patient inhale, if they have asthma, they trigger the asthmatic attack right away. They get short breath and wheezing, and usually most physicians have to give them the bronchodilators, mean the chemical, the medication to dilate the bronchi again, and patient able to breathe again. So these tests may help to identify the people really have real asthma.
So what are the complications of the disease if it was untreated?
The complication is really just need to remember, because it's from mild complication to severe. The mild complication is chronic cough and decrease the level of exercise, And also, the very important is the severe cases of asthmatic attack. People cannot get the air and they develop respiratory failure. In these cases, patient have to call 911 or go directly to the hospital. Therefore, in terms of treatment, the severity of asthma was divided into 3 different levels. The first one is mild to moderate. People have short of breath, but it's usually when they exercise or when they're walking, they develop wheezing when they walk. The respiratory rate means the breathing is always never go over 28 per minute. But for severe cases, they develop short breath even though at rest, and then the breathing is usually over 28 per minute. In severe case called asthmatic attack, people could not get air anymore. They sweat, the heart rate will increase over 120. So these are the 3 levels of severities of the asthma that the patient needs to be aware, or the physician who take care of them need to know, because to deal with the acute phases of the disease.
Okay. Dr. Tran, that is all the time we have for today. Thank you for joining us, sir.
Thank you for watching our medical news, and again, thank you for listening.
Thank you, sir. That was Dr. Tran, who just shared with us the information on asthma. In the next edition of the medical news, we will talk about treatments and how to prevent asthma. Please stay tuned. We hope that the information provided by Dr. Tran had shed more light on the disease. That is all the time we have for the edition of medical news today. Thanks for watching. I am Tu Kim Lam. We'll see you in the next one on the medical news. Until then, have a great one.